Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us, yet again, Dr. Paresh Pai. Dr. Paresh Pai is a Senior Consultant Vascular and Endovascular Surgeon at the Bombay Hospital, the HN Reliance, Hatia, Beach Candy, Hinduja, Kambala Hill, Lilavati and Raheja Hospitals in Mumbai. With more than 2 decades of experience in the management of cerebrovascular disease, distal small vessel reconstruction in diabetic and atherosclerotic limbs, venous thromboembolic disease, and endoluminal treatment of aortic aneurysms. Dr. Pai is a former treasurer and secretary of the Vascular Society of India. He's a past consultant vascular surgeon at the Westmead Hospital in Sydney in Australia. Welcome to Health Live at Seniors Today once again, Dr. Pai. How have you been?
I'm good. Thank you, Mr. Maheshwari. It's a pleasure to be here with you today.
And how's the scenario been in the last 2 months since you were here last? What do you think? We see the number of cases rising in Mumbai, COVID cases. Is it, since you are associated with so many hospitals, what is the buzz around town?
Well, we are getting positive cases, but fortunately, not many of them are requiring hospitalization, ICU beds, and the mortality rate is much lower than what it was in the second wave. So we are hoping that with the vaccination, especially 2 doses, we are hoping that the incidence of moderate or severe COVID will be very low, but it remains to be seen. One thing COVID has taught us is that we don't know much about it, and we keep changing what we know about it. So I think we have to accept that limitation and move around and deal with the cards the way they're dealt to us.
Every time you see a photograph of crowds in Dadar market,
it's very scary.
So, what is your sentiment?
Oh, I get the shudders. It's a deja vu kind of feeling, It's really scary. I can understand people are frustrated and they want to get out of it and they want to lead a normal life, but it's really, really scary.
So thank you once again. The topic that Dr. Pai is going to be speaking about today is diabetic foot. And if you have any questions, please put them in the Q&A tab. As always, mention your gender as well as your age. And that will help Dr. Pai answer the question. And over to you, Dr. Pai.
Thank you. I will go on to my screen share. Just give me a minute. Is the screen visible to everyone?
It's visible. It's visible.
Great. Thank you. So everybody, I used to be always asked, what is a vascular and endovascular surgeon? What do you deal with? So that is the reason why I made this logo, so that it's kind of self-explanatory. We deal with blood vessels which supply the brain, and we operate on these vessels if they are causing strokes. We operate on arteries if they are blocked or if they are ballooned. We also treat patients with leg ulcers where there's, the wounds don't heal in spite of expert care from other doctors, and diabetic foot, which we will talk about today. The other thing is the arteriovenous malformations, which are congenital or post-traumatic that take place, and there's an abnormal communication between arteries and veins. Venous diseases like varicose veins, deep vein thrombosis. Then I also get a lot of patients with leg pain where, patients are, it becomes more of a challenge for diagnosis. And of course, the swollen legs, which can be because of a number of reasons. And the motto of ours is limbs for life. So today we're going to focus on diabetic foot and you. It's an eye opener. When I say eye, it has dual meaning. One is I would like each and everyone who is a diabetic or knows who are diabetics to use what information you gain today, because it's extremely practical. It's not going to be very therapeutic, it's not going to be very theoretical. And the whole idea is that it gives you an insight into the whole problem and what one needs to do to stay out of trouble. So there always in life, there are different viewpoints. What do you see when you see this? Do you see a face or do you see the word liar? When you see this, do you see just blocks or do you see the word lift? And when you see this picture, what do you see? Do you see an old lady or do you see a young lady with a choke around the neck? So it all depends on how you look at things, and the same thing can can appear to be different. So this talk is mainly geared towards the general public. All of you are seniors, you're leaders, you were leaders in your own field and still continue to be leaders, and you are advice givers. A lot of people come and ask you for advice. So it's very important that you have some knowledge about this. And what I will do is I will bridge the gap and try to give a perspective from that of a vascular and endovascular surgeon. So sometimes the view is a new perspective and it can look a little different when you see it from my eyes. So objective of today's presentation includes one, some simple facts about diabetes and what we need to know about a diabetic foot, how to identify, plan the action, and focus on preventive care, and also just touch upon the treatment options which are available. There's a lot of information, so I'll try to keep it simple by using the rule of three, where I talk about the three most important points in each topic. So what are the facts about diabetes? One, this is a disease that not only interferes with metabolism of sugar, but also causes problems of blood vessels, affects the kidneys, affects the nerves, and affects the eyes. And basically, there are two types of diabetes. The type 1, which is seen in children or young people, there's a shortage of insulin because it's not produced. And type 2, where there is insulin and sometimes there's excess of insulin because the pancreas starts producing more insulin, but there is a resistance at the organ level, and that is called type 2. So most of the elderly people who get diabetes is type 2. According to the International Journal of Diabetes, India has the dubious distinction of being the diabetic capital of the world. And not only that, the Indians tend to get diabetes at a much younger age. And since there's a risk of being neglected, this results in heart disease, loss of limbs, kidney failure, and it ends up shortening the lifespan by about 8 to 10 years. 25% of diabetics have arterial involvement, and 50% of hospital admissions are for treating infections or wounds in the feet, what we term as diabetic foot. So diabetic foot may result in risk of loss of limb or even sometimes life if the infection gets really bad. So what do we want? What should you know about diabetic foot? So why diabetic? This is because diabetics end up with a diabetic neuropathy where the nerves are affected. And this can involve either the sensation or sensory part or the motor part. The sensory part, when it's involved, you tend to lose your proprioception. That means the sense of pain. And therefore, you can get injury and not realize that you've injured your foot. Not only that, as a result of the sensory involvement, there is imbalance. People tend to fall and hurt themselves. With motor involvement, there's a disproportionate involvement. The shape of the foot changes. Patients with diabetic arterial disease, there's a narrowing of the artery, reduction in the blood supply, and therefore when you end up with the wounds don't heal because the blood supply is inadequate. Diabetic retinopathy is the involvement of the small blood vessels in the retina, and this results in reduced vision. And as a result of that, people can't see very well, and therefore they tend to bump into things or injure themselves more often. Why Indians? A lot of us walk barefoot at home, in temples, sometimes even outside. There is very poor self-care and fetal hygiene in some situations. And the end user pays. So people are cost conscious. They often present very late. They are very reluctant for aggressive intervention. And ultimately they end up losing the limb because they come very late. So why risk to limb and life? The altered shape and sensation results in repeated injuries and wounds. So with great difficulty, you get the wound to heal. And then when you start walking and start doing your routine activities without taking adequate care, there's a chance for the wounds to come back and give trouble. Many of us have time for doing things for others as well as time for work, but very few take time out for ourselves. So we don't exercise adequately, as a result of which, when there is narrowing of the blood vessels, the collaterals don't develop very well. As a result, there is poor blood supply and medicines don't work, because medicines, after all, travel in the blood. With infection, the sugar goes up, and as a result of that, the infection spreads locally and into the body. So how does one identify a diabetic foot? So first is the history. So anybody who has a history of prior diabetic foot in the form of recurrent corns or calluses on the feet, this is what your calluses or corns look like. And you can see that there's a change of the shape. These are the areas which keep getting injured, or it's not a major injury, but it's a minor injury. There can be wounds or ulcers. Some of these are active, and you can see the infection in this particular one. You can see the little redness that is here. All this suggesting that there's infection, dead tissue here. So these are active non-healing ulcers. Or you may have situation where somebody's had ulcers in the past. It has healed, but took quite a long time to heal. Some ulcers are recurrent, such as this. You can again see the change in the shape of the foot. As a result of this, what happens is that the tissue becomes hard, and that hard tissue acts as if it's a foreign body or a stone and keeps damaging tissue which is deep inside. And ultimately, the body gets rid of the tissue and you end up with a wound ulcer, with ulcer like this, called as a pressure ulcer. In some situations where there is added infection, you get gangrene, this blackish discoloration that you can see. This is the heel. These are the toes which are gone. Again, the toes which are gone. And this is what happens, what we call gangrene. If also there is a history of amputation of the toes in the past, then that again tells you that this is a patient with a diabetic foot. You can see here, the little toe has been removed. Here we've had to remove 3 toes, and we've managed to get the plantar aspect of the skin to come up and close that area. So besides what we talked about, history, also somebody who has altered sensation. Typically, with reduction in sensation, patients have difficulty holding on to their footwear, and they are unaware of the footwear slipping off. So they start off walking with slippers or a chappal, and while walking, suddenly the slipper slips off and you don't even realize. And suddenly they realize that they have injured themselves and there is bleeding. If there is somebody with numbness in the feet, or there's absolutely lack of sensation, or somebody with cotton wool sensation, that means you feel like you're walking on cotton wool, or there is a glove and stocking sensation, that is reduced sensation in both the upper limbs, the hands and the feet. Sometimes there may be pricking sensation, pins and needle sensation, tingling sensation, and in some situations, there's a lot of burning pain in the feet. Then altered shape. So there's typically crowding of toes. This is typically seen in people who are used to wearing footwear, and generally narrower footwear looks more classy. People tend to use a lot of narrowed footwear, and as a result of that, there's crowding of the toes. And this is what you see, that wherever there is crowding and wherever the toes bend, come up, these are the areas where they rub against the shoe and cause injury. Sometimes they also a prominent metatarsal head. So you can see here that normally the muscles which straighten the toes and those which bend the toes, they are well balanced. But in diabetic neuropathy, with the muscle involvement and the motor involvement, these muscles tend to become stronger and these muscles tend to become weaker. So the shape changes. And here you can see that there are 3 areas where there is pressure coming onto the heel, onto the balls of the toe, as well as the tip of the toe, the pulp of the toe. You can see that this gets repeated injury whenever you are walking. It's a very minor injury, you don't realize, but as a result of that, you get a callus formation. So sometimes this can become more aggravated and you get what is called as hammer toes. You can see the hammer toes here. And typically with the hammer toes, you see that there is injury not only here, but also this area where it tends to rub against the cover of the shoe. At times, there is collapse of the arch, and as a result of that, what happens is that the pressure comes mainly in this part and people end up with wounds. In some situations, the entire joints and the ligaments and the muscles in the foot become extremely weak, and the foot tends to collapse. And that is what is called as the Charcot's foot. And there's a very high risk of repeated infections, repeated trauma, and limb loss in Charcot's foot. We do this test called as a plantar foot pressure scan, and that gives you an idea of where the pressure distribution is as far as the foot is concerned. And this is extremely useful to identify and then decide what type of footwear modification that needs to be made, so that you can see this is the normal foot. There is no particular pressure in one particular area. So wherever there is red color, there is a lot of pressure. And you can see, depending upon the footwear which is turned inwards or outwards, you get either pressure at these points, or you get pressure around the outer side, or you get pressure in a high arch at the heel and the ball of the toe, or this is a heavy heel, or this is a flat foot where you can see that there is pressure at these points which we saw before. So in addition to altered sensation, there can be altered circulation. Patients generally tend to tell you that they have cold feet or legs and it feels really cold. They also get cramp-like pain in the calf on walking, especially if the artery in the thigh, which is called as a superficial femoral artery, is narrowed or occluded. So blood supply to the calf muscles is reduced, and as a result of that, they get pain here. If the blood supply in the arteries above is reduced, then you may end up with pain in the thighs or the buttocks. And if the arteries below the knees are diseased, then you might get pain in the feet when you walk. In very advanced cases, when the blood supply is significantly reduced, you get burning pain in the feet. And this is typically worse on lying down. And this is relieved when you hang the foot from the edge of the bed. As a result of the gravity, the blood supply increases. And this is called as rest pain, or also called a cry of the dying nerve, because the nerve is crying out because it has reduced blood supply. And of course, that we talked about last is that in the advanced cases, there can be gangrene and ulcers. Reduced vision in the elderly is also because of cataract and diabetic retinopathy. And this is something that needs to be identified and corrected. So based on the presence of these various factors, which includes history of either an ulcer or limb or toe, a loss of a part of the toe foot, whether there is neuropathy, whether there is peripheral arterial disease, or whether there is deformity or there is diminished vision. So if all these 5 things are intact, there is very low risk of having a diabetic foot. If either of these things are present, then it's a moderate risk. If more than one is present, then it's a chronic high risk. And if there is an acute or active ulcer or a wound, or if there is a Charcot's, then it's called as an acute high risk, where many of these things can be present and the risk of limb loss is very high. So what is the action plan for prevention? So let's focus on prevention, because I think this is most important. So there are 3 things that we ask for. What must I do as a patient, or what must I do as a caregiver, or somebody who was known to me who has diabetes and diabetic foot? What must my family doctor do? And when should I go and see a specialist? So let's take these answers one by one. The first one, what must I do? I must control all my risk factors, which includes losing weight or controlling the weight. Stop tobacco use in any form. You should not replace one form of tobacco for another. Take regular exercise with walking, and always wear appropriate and good quality footwear, because that's really important to prevent any injury. Control blood pressure, control the sugars, and control cholesterol. So that's the first thing, control the risk factors. The second thing is to maintain good fetal hygiene. It's extremely important that you take out 2 or 3 minutes, clean the feet properly, clean the toes, clean the areas around the nails, both on the side of the nails as well as under the nail, and pay particular attention towards the web spaces. You must clean the toes in space in between the toes, because that's the area, if it tends to get moist, gets fungal infection and then starts downward descent. It's also very important to dry the feet properly after a wash. And if it's difficult to use the towel to get into this space, one can use a hair dryer where you can blow air and dry out these areas. If the skin is dry, use moisturizer, but try to avoid using this in the wet spaces, because if you use it in the wet spaces, the moisture makes that area very wet, or macerates the skin and results in fungal infection again. Most important is to avoid injury. This can be in the form of either mechanical injury, thermal injury, or chemical injury. Mechanical injury takes place when you trim your nails. It's better to cut less than to cut more and end up damaging tissues, because whenever you have a reduced circulation, if you have any damage, then it's likely that it may not heal. It's extremely important that you avoid walking barefoot. And what is also important is whenever you're using new footwear, check that that the shoes are not too tight, or that there is no hard surface inside which can cause a shoe bite. Thermal injury is heating pads and heating bottles. You have to be very, very careful about, because with the sensation, the temperature sensation also reduces, and one doesn't realize when the heating pad is too hot and it results in burns. Chemical injury is again important, particularly when you use corn caps. People say that, okay, I'm using Dettol and Savlon, but remember that these have to be diluted and then used. If you don't use it, it's extremely caustic and results in damage to the skin. Also inspect the foot daily. Use a mirror, and if your vision is reduced, take help of somebody with good vision. Check the top of the foot, the bottom of the foot, and the web spaces. Look for red areas, look for wounds, look for calluses. Monitor sugar levels frequently. Weekly, try to do your finger prick sugars for before breakfast, before lunch, before dinner. Urine sugar and proteins to be done once a week. Quarterly, you can check your fasting blood sugar, post blood sugar, or HbA1c, which gives you the average sugar levels for the last 3 months. And if everything is normal, half yearly, you can also need to check your creatinine, because that tells you whether the kidneys are working properly or they are being affected because of the diabetes. A regular checkup with your family doctor, with your diabetologist and specialist, if required, is also advisable. So what must my family doctor do when I go and see him? So one is, he must ensure that the regular checkups are done, where he should monitor your weight, your pulse, your blood pressure. He must check your feet. He should inspect them, feel the skin, check for warmth. All this, see, if you are just sitting in front of him, this is not going to happen. So you need to get onto the examining couch, and he needs to have a look at this. Most people, they walk into the doctor's chamber, he just checks his blood pressure, pulses, looks at your sugar reports, but doesn't really look at the legs. So that is not something which is right. He must look for pulsations, and he should keep a record that, okay, this visit, this pulse was there. Next visit, oh, this pulse is gone. So that's the time when you know that there is some arterial disease which has progressed in between the 2 visits. He must also check for reduction in sensation, and he must review your sugar levels and blood reports and keep a chart so that you have a comparative value to know what the trend is like. Maintain these records, look for prognostic trends, whether static deterioration or there is improvement. He should refer you to a specialist regularly if required, especially if your sugars are not coming under control, to either a diabetologist, or you have somebody who looks after the feet and is called as a podiatrist. Sometimes you might need to get special footwear made or modification of footwear done. So you refer to an orthotist. And if the vision is reduced, you refer to an ophthalmologist to get the retina looked at. Whenever there is a crisis and there is a problem, you need to see a surgeon. Either it's a vascular surgeon, an orthopedic surgeon, or a general surgeon. Depends on what the issue is. And if the kidneys are weak, then we must get you seen by a nephrologist, a kidney specialist, who, and this is not that only when the kidneys are badly damaged, you shouldn't go to a nephrologist. You should go to a nephrologist in the early stage so that you can get appropriate advice of how to preserve your renal function and how to delay the onset of renal problems. So when do you see a specialist? One, when the sugar levels are poorly controlled, where the HbA1c is more than 9. When there are specific problems which exist, such as the heart problems, kidneys, or there is problem with the arterial circulation, and especially if you have a diabetic foot with moderate to high risk. So these are the times when you need to see a specialist. So we focused on prevention. So now let's look at what are the treatment options during this thing. So one is offloading. Offloading means whichever side has pressure, you must see to it that the pressure is offloaded from that area. And there are many ways of doing that. You can use a diabetic gel socks, or you can get special type of insoles made, or you can get insoles which are made of small pieces, where you remove the piece wherever there is pressure, so that that area doesn't come into contact. You can use medications to improve the sensation of the foot, and you can also get medications started which help improve the circulation. So offloading. Here, this is special footwear. There's footwear modification. And not only that, sometimes you may also need to do gait training. You can improve the sensation by controlling diabetes, correcting vitamin B12 deficiency, and giving medications to improve the nerve function. Circulation can be improved by using aspirin, a baby aspirin, drug called clopidogrel, Trental, which improves the blood supply, silostazol or Stilose, which reduces the progression of the disease, and statins, which help control cholesterol levels. You can also do supervised exercise protocol, where you walk under supervision, walk at a particular pace, ensure that whenever you're getting symptoms, you take adequate rest and start walking again. And by this, you develop collateral. So this is supervised exercise protocol. We use a treadmill, get patients to walk regularly, or at least once or twice a week. And this is something which they can continue doing at home. So walk on treadmill under supervision and gradually increasing the stress level. We periodically monitor with a questionnaire, ankle brachial index improvement. That's the pressure which is taken at the ankle level as well as in the arm. And we also do the exercise stress test, which looks at how much is the drop in the pressure with the exercise and how long it takes to recover. Whenever you find that there is narrowing and there is risk to the limb, we can do angioplasty plus minus stenting to improve the blood supply. This is one such patient. Here you can see that there is good arterial flow here, but you can see that there are arteries going down, but they are very small. This is somebody who ended up with gangrene of the foot. So we did angioplasty and we opened up this artery, we opened up this artery, and you can see that the quantum of blood supply to the foot has increased dramatically. Sometimes we also do surgical bypasses. This is one such patient where we did a bypass from below the knee artery and joined it to the artery in the foot. On table, this is the angiogram which is done, where you can see the connection here. And this is the connection in the foot, where you can see the bypass is onto this artery. And with this, the wound improved. This is how the wound is after removing these stores. These were the gangrenous stores. And with time, this improved and we managed to put a skin graft and get the wound to heal. So to summarize, why diabetes and diabetic foot is important, we have looked at. We have identified how to identify diabetic feet and develop an action plan with preventive measures. We have also looked at simple treatment options. So what is the take-home message? So all diabetic patients are at risk. Some are more than the others. Proactive preventive care is a must, and this is a daily, regular, and diligently done activity. There are no shortcuts here. If you give your name to Mr. Maheshwari, I'm in the process of making a diabetic foot patient self-care manual. Once that is done, I can share it with you, or I can share it with Mr. Maheshwari and he can share it with you. Take help early rather than late, because this is very important here. The proverbial stitch and time saves 9. Saving limbs is possible provided we act at the right time. So what I've tried to do is give a new look to an old problem. And all this requires a multidisciplinary team effort. It's important that we prevent limb loss and also reduce the incidence of death as a result of this problem. All this requires a lot of dedication and patience, but it's important to aim high but play safe. I can't give you limbs like this or like this, but certainly I can give you something which is more important. We can save your legs, keep walking. Thank you.
Thank you very much, Dr. Pai, for this presentation. Aim high and save lives.
There are some questions, Mr. Maheshwari. Can I answer them?
Can I just request you to end the
Screen share? I will. Sorry. Yeah.
great. So we have a few questions that have come in, and I'm going to pose them to you one by one. So Dr. Martin Azzi has asked, how can a foot ulcer be prevented?
That's a very, very good question. And this is something that I have discussed in the talk. First and foremost, it's important to categorize the foot or the patient's limb in the category that I talked about. And that is based on the history, presence of neuropathy, presence of arterial insufficiency, presence of retinopathy, as well as any history of limb loss in the past. So anybody who has this, you know that this person is at risk of having this problem. And then you look at various measures to see that you prevent these ulcers. So most important is never should they ever walk barefoot. 24/7, they should use what is called diabetic gel socks. So basically what happens is that the pressure or the weight is distributed across the entire foot and not allowed to be in one particular area. Second question is, what is the connection between, and to also add to that is regular checkup is important on a daily basis, especially when you're having your shower or a bath. So that's the best time to have a look. And sometimes if you find that people are not able to bend and see their the plantar aspect of the foot, then you can take the help of a mirror, and you should see that, and it should be properly lighted so that you should have adequate light so that you can see well. And also look for all those areas where there is hardening. So many a time the patient is not able to do it himself. So whoever is helping, looking after, the caregiver can do that. What is the connection between tobacco use and diabetic foot?
That's right.
Tobacco and nicotine ends up causing narrowing of the arteries. And as a result of that, it results in reduction in the blood supply. And that is the reason why you end up with, diabetic foot. Do ingrown toenails indicate that one has diabetic foot? No, not at all. But ingrowing toenails tend to cause tissue damage. And if you have somebody in this kind of situation, then once there's damage and there is either reduction in circulation or there is reduction in sensation, wound healing becomes an issue. And that is the reason why you can end up with infection and limb loss.
Instead of moisture cream, this is a question by Mr. Lakshminarayan. Instead of moisture cream, can I use coconut oil on my feet?
Yes, absolutely. Just one little precaution one needs to take is try not to use too much of edible oils, because when you use edible oils, it attracts cockroaches, insects around, and therefore what happens is you can get injury in the form of these insect bites. So that is something which is very important.
All right. So we have a question. We have two questions on flat feet. One is Mr. Arvind Navre, who asks any precautions, and the other is by Mr. Santa Maria, who says, I run bare feet at 80 because I feel more comfortable. Is it okay?
So the first one is, if you have a flat foot, this puts you at risk for having either pressure sores, as well as there is a chance of having osteoarthritis of the ankle area. So therefore, it's good to use footwear which has an arch support. So as a result of that, the foot weight gets redistributed the way it is supposed to be, and therefore it saves a lot of trouble. Now, what was the second question, Mr. Maheshwari? I missed that.
The question was about I run bare feet at 80 because I feel more comfortable. Is it okay?
If you're diabetic, then it's not okay. If you're not a diabetic, if your sensations are fine, then maybe it's okay. Ultimately, it all depends on what you're used to, what is the condition of the soles of your feet. So based on that, you can take a call on what you should do and not do. But definitely, if you're diabetic, that's a strict no-no. Try to get footwear which you're comfortable with, which is nice and soft, and which doesn't have any hard areas like, you have sometimes knots or stitches which can aggravate the situation and result in problems. So please use footwear which you're comfortable with. And these diabetic gel socks are excellent and they really work well. Just one word of caution. In diabetic gel socks, when you start using diabetic gel socks, remember that you might need to take a shoe size bigger than what you normally use. The reason is that the diabetic gel socks will occupy some space and you might end up, your shoe might cause a shoe bite, especially if you're using the same size. Similarly, one more word of caution is in diabetic feet, the sensations are reduced. So to get a feeling of appropriate footwear, people tend to use a foot size, a shoe size which is smaller than what is ideal for them. So I use what is called as a one finger test. You wear your shoe and you see whether your one finger can slide behind your foot. If it can slide easily and there is space, then that's the right size. If there's difficulty for it to go in, it means that the shoe size is a little tight. And if you find that there is not one but two finger spaces, then it means that the shoe size is too big. And when it's too big, there is a risk of sliding and friction creating problems.
Right. We have a question from Ms. Vimla Baird. Half my foot has capillaries burst, causing black spots. Can it be cured? I'm 74 and take Xyluric.
Okay, so basically you have uric acid metabolism issues, but these capillaries bursting or capillaries forming can be because of two reasons. It can be either because you have varicose veins, and these are small dermal capillaries which tend to get the pressure and therefore they burst, or it can also be because of neuropathy. Neuropathy can be either diabetic neuropathy or vitamin B12 deficiency neuropathy. As a result of neuropathy, what happens is that the normal mechanism of the blood vessels tightening up when you stand is lost. So therefore, there's a lot of pressure in the standing or sitting position, the legs dangling down. And as a result of that, sometimes these tend to burst or you have minor blood leaking out and you see these things. Generally, in the venous part, you tend to get them to be bluish, blackish in color. And in the neuropathy part, you tend to be more brown in color.
We have a question, two questions from someone. One is, my feet feel wet, but they are dry. Why? And the same person has asked another question. My right foot or fingers are a bit weaker than the other. Many times I try gripping my footwear with the toe and the next finger, but poor grip. Anyway, it can be cured. I'm 66 and walk 6.5 kilometers daily in an hour.
Fantastic. I think you may have vitamin B12 deficiency, and as a result of that, there is a neuropathy, and that is something which you should check. There can be neuropathy of other reasons also, and that may need to be investigated. So what you have is paresthesia. Paresthesia means it's an abnormal sensation or not a normal sensation, as a result of which you get this feeling of it being moist or weak there. And that is the reason why you get this funny feeling which is there. So while walking, no problem, use proper footwear. You might benefit with using compression stockings over which you can use the gel socks or ordinary socks which are well padded, and use good quality footwear. The footwear needs to be adequately soft, padded and light. Some of these sports shoes that you use, they tend to get a little heavy and they may create more difficulty. Whereas if you have these lighter ones which are well padded, they are likely to be worth the investment that you make.
We have a question that has come in, which is, I'm 65 years old. I'm overweight in the lower part of my leg, and I get a boil. It creates a head and is very painful. What could be the cause? I hardly walk because of overweight.
See, so probably what is happening is whenever you're walking at home, going from the bed to the toilet or, moving around in the house, there may be an area which tends to get injured because of the weight. And as a result of that, what happens is you end up with these boils or blisters or sometimes there can be friction that is taking place between the footwear and this. So you need to address that, and you need to focus on trying to lose weight. If you have difficulty and you're not able to walk, perhaps you could use an exercise bike, because that will help you burn calories. First and foremost, you need to control your dietary intake and see that there's a balance between your intake of calories and the calories you expend, so that you don't have this thing. And you may also need to check whether you have a thyroid issue, because hypothyroid patients tend to have a tendency to be overweight because the metabolic rate is low. So that may need to be corrected. So all these factors need to be looked at, and once you look at them, then you can treat the root cause and come. But it's important that the earlier you lose the weight, that will be better for you.
Thank you. We have a question from Mr. Rajnikant Jilani, who says, I'm a male, 68 years old, diabetic for more than 15 years, now sugar below 200. Sometimes in the night while sleeping, one of my leg calf feels numb. Then I get up by the bedside and jump the leg a bit, and it gets back to normal. Is blood not circulating properly? How do I take care of this?
Okay. See, blood sugars close to 200 are not optimal. You need to get them down, get them a little lower down, especially it's not clear whether it was fasting or post-lunch. So sugar control needs to be good. Again, you need to check your B12 levels. And this generally with reduction in circulation, the pain is usually on walking. It is not on lying down. Sometimes this pain that you're describing is more common in venous situations, where you have either venous insufficiency in the form of varicose veins, or there is collection of blood. And as a result of that, the muscles are very irritable towards the end of the day. And therefore, you tend to have this problem. When you walk, what you're doing is your calf muscle is pumping the blood and removing the blood from the calf muscle. And therefore, it is reducing the venous congestion. Another alternative is you can see if your circulation is good. You can raise the foot end of the bed by maybe 4 inches or so that there's a very gradual slope, so that when you retire, when you rest, the gravity helps reduce the venous congestion that has taken place. And as a result of that, the leg swelling or the calf swelling comes down, the muscles get less swollen, and therefore you get relief. Alternatively, you can also do is just move your feet up and down at the ankle level in bed when you're lying down, and that might also help improve the venous drainage. Because essentially what you say when you jump around or move your feet around, what you're doing is you're using the calf muscle. So if you're using it in the lying down position, maybe it might work also.
I have a question that has come in. Is diabetic foot reversible? Can I get the sensation back after my sugar levels are under control?
Excellent question. It really depends at what stage you pick it up. But generally, if you have diabetes, then the battle is ongoing, and you need to take care for the rest of your life unless you're able to correct the diabetes. So see, any disease that you have, there are 4 stages. The first stage is the early stage. With adequate care, one can reverse it, one can get rid of it. Second stage is where you know you can't get rid of it. All you can do is keep it under control and prevent its progression. The third stage is one where you can't prevent the progression, but all you can do is see to it that it progresses slowly and complications don't develop. And the fourth stage is where complications already develop, and you can ensure that the complications are kept under control and don't progress and result in more problems. So if you have picked this up at a very early stage and you correct the situation, then there is a good chance that you might recover your sensation. Like for example, suppose the sensations are reduced, or you have burning pain as a result of both diabetes and vitamin B12 deficiency. Correction of diabetes and correction of vitamin B12 deficiency will give you dramatic relief in burning as well as pricking sensation, tingling sensation. There are special drugs which are available, which are meant for this kind of problem, and that is something that can be used. There are also other drugs which are more potent, and sometimes they do cause side effects in the form of drowsiness, lightheadedness. So it depends on what stage and how bad the symptoms are. We decide which medicines to use. Obviously, we don't like to use our Brahmastra in the first stage. we tend to reserve that for cases which are more advanced, because obviously these are very potent medications and they have their own side effects if they are used indiscriminately. Second problem is of a flat shoe. In spite of using insole, the leg fingers are stressed and I can't walk very much. Yeah, you might need to take a help of a good orthotist who will see to it that he gives you not only the proper footwear in terms of the heel as well as this. And what is important is you use broad footwear. Don't use narrow footwear. Use special broad footwear so that the toes don't get squeezed. With this and with using a proper insole, because insole also there are very many types. Depending upon the type of the foot, you decide which insole is prescribed or which is required. And based on that, if you find, you may find that your walking and all will improve. The other thing which is extremely important, Mr. Gupta, is sometimes the reason you're not able to walk or this is maybe you have severe osteoporosis or osteopenia, and the entire weight of the body falls on the foot. So if that is not addressed, then your pain may not go away. So all these are finer nuances. The most important, this is a bit like being Sherlock Holmes. You have to identify what the problem is, why it is taking place, so that you can give the correct advice and the treatment.
And we have Mr. Sherlock Holmes speaking to us right now.
Or maybe Dr. Watson.
So we have a couple of questions which I can just quickly ask, because I know we are crossing our deadline. We have all the questions from Mr. Ram Malkani. Can venous hypertension be reversed by medication? Does Daflon help? Stilose causes headache at times. And the last question is, where are insoles available? I have another question that has come in, that my shoe size is very large. Where do I get diabetic socks and insoles for my size?
Okay. So just quickly, I will take care of Mr. Malkani's question because he's been asking it. He's been asked for quite some time. Venous hypertension depends on the severity. In the early stages, you can use Daflon. Daflon does help. It's a venous tonic. It's a microflavonoid, and that helps. Secondly, sometimes for correction of the venous hypertension, you might need to use what is called graduated compression stockings. When I say graduated compression, this is what we discussed last time. It's more tight at the ankle and less tight upwards so that the squeeze is below upwards. Insoles are available in many places, but if you want medical insoles or special diabetic insoles, there are companies which provide this kind of care, and you can reach out and I can provide you with the addresses. And there's also a company called Norma, which manufactures various types of diabetic insoles. So you can also get in touch with them and they will be able to help you out.
Can you repeat the name again of the product, of the brand?
It's called Norma, Norma.
Norma. I'll just put the name here on the chat. You can have a look at it. Thank you, Dr. Pai, for spending all the time today and for your presentation. Those of you who have come in and who would like to see the presentation once again, we will have the video of this session on seniorstoday.in on Monday morning, as well as the takeaways of this session. So please look up seniorstoday.in. If you don't get the newsletter, you can subscribe to the newsletter and you will be alerted and you will get the link in your mail about the session. Once again, thank you, Dr. Pai, for
my pleasure.
And we will have your coordinates, have your phone numbers in our takeaways. So those of you who would like to reach out to Dr. Pai at the various hospitals he visits or his clinic, you can always do that directly. And the toolkit that you mentioned for diabetic foot, I will look forward to receiving it, and
sure, I'll send that to you.
Up on the website. Those of you who would like to have the toolkit, please email us at editor@seniorstoday.in. I'm putting the mail address in the chat window. And please just write over there in the subject diabetic foot toolkit, and we will have it sent to you by email the moment we have it. Thank you very much once again for Dr. Pai, and thank you everyone here for being around. And we will be there once again next Saturday at 5 p.m. with our next session of Health Live at Seniors Today. Thank you once again.
Thank you. Bye-bye.